Great. Hi, everyone. Welcome to our attendees, both in the room and online. This is a Think Global event by the Duke Global Health Institute, and I'm specifically representing the Duke Global Health Innovation Center. This session is called Food for Trust, thinking about nutrition guidance, influence, and lessons for trust and health. We will be thinking globally as well as domestically, including thinking about the role of the United States and American philanthropies as they consider or support nutrition abroad. Overall, the divergent guidance and disparities in nutrition and flawed food environments and policy can and do surface anywhere. And we want to consider how this can affect not just health, but trust in health. So a few logistics before we get started, and I want to make sure I get these right, so I'm checking my notes. Today's session will be recorded and posted publicly, including comments and questions that you may say by voice or in writing, so keep that in mind. Although we encourage questions. We will have time for Q&A at the end. We have about 10 minutes for that, and welcome questions both from our in-person and online audiences. Folks in the room, you'll be able to just raise your hand when we open it up for questions, and online participants, you can put your questions into the Q&A tab at any time. We're going to monitor those, and we're going to try to get as many of the online questions as we can while giving a little bit of preference for folks who are here in the room, which we really appreciate. So our goal today isn't to tell you whether we should all be taking creatine or avoiding ultra-processed food, but to look at how those questions get answered and discussed through science, through policy, and through communication, and how trust is built or lost along the way. Further, we'll consider the role of messengers, including some that we have on our panel today, in both physical and virtual communities, and how this can shape nutrition-related behaviors and beliefs. So I'm Dr. Heather Lanthorn. I'm an associate director at the Duke Global Health Innovation Center, where part of my portfolio is a trust-focused initiative called Healthier Together. It's rooted in the importance of communication, community, and capacity, drawing on the strength of our team at Duke GHIC, the COVID Collaborative, and your local epidemiologist. And one of our panelists is a writer with your local epidemiologist in her spare time. So when I talk about nutrition policy, even here in the United States, I mean a lot more than what happens in Washington, D.C. At the federal level, we have dietary guidelines that get set, visualized as MyPlate, which you might know about. And we also have SNAP, or food stamps. At the state level, school meal standards that build on the federally set minima are set, and new bills are passed around food additives and many other things. And I suspect Megan's going to tell us something about that. Cities also innovate, such as sodium warning labels on menus in New York City, and DINE, Durham's Nutrition Education and Vendor Collaboration Program. And finally, communities in physical spaces like schools or churches or food banks or farmers markets, as well as online communities, whether it's around weightlifting or cooking and all kinds of things, set norms that shape behavior. All of these layers shape our daily choices, and they shape the trust that we have in health. I think throughout we can remember that nutrition isn't just about policy, it is deeply personal. We all eat. And so this is something where we have experience with. So I am delighted to now introduce today's wonderful panelists, and together we're going to talk through the role of evidence in nutrition policy and practice, how official policy is and is not informed by evidence, and how trusted messengers may take advantage of our current national dialogue to shape individual and system nutrition policy and practice. So I'm just going to give extremely brief intros to each of our panelists, but please look at their full biographies on the website. And of course, panelists, as you give your opening remarks, you can give a little bit of your bio as well. So online, first up, we have Alonzo Plow. So Alonzo is the Chief Science Officer at the Robert Wood Johnson Foundation, which he joined, he's also Vice President of Research, Evaluation, and Learning. He joined there at 2014, so he's been there quite a while, and he is responsible for aligning all the foundation's work with best evidence from research and practice and incorporating program evaluations into organizational training. Emily Koppel, also online, is Policy Advocacy and Director of Policy Advocacy and Communications for Food at the Rockefeller Foundation, and is an adjunct lecturer at the City University of New York. And she brings extensive cross-sector experience in food systems, health, education, and development. Also online, Megan Maizano. Megan is the Senior Director of Nutrition and Regulatory Affairs at the National Dairy Council, and as I said, a contributor to Your Local Epidemiologist, where she connects science to storytelling to lead evidence-based communications, outreach, and education. And finally, right here with me, we got Megan Lott, who serves as the Deputy Director for the Healthy Eating Research here at Duke, which supports research on environmental and policy strategies to promote healthy eating among children to prevent childhood obesity. This is a diverse and exciting panel, so I think we're going to have some good fun together. So to kick us off, to set up a little bit more learning about our panels as well as our topic, I'm going to ask each to tackle the following question and connect it with their personal and professional roles with about 4 minutes each. And we're going to start with Alonzo and then go in the order of introduction, which was the order with the alphabetical order of their first names as well. So I'll give you the question, then I'll turn it over to Alonzo. So first, how does your work intersect with the goal of defining or refining what we understand as healthy and helping more Americans and global citizens understand the benefits of eating that way and helping them to do so? And the second bit is, how do you think about the role of evidence in your work? What evidence do you produce and use and how? And what do you wish you had more of? That is, where do you see the biggest concerns and research needs, both in nutrition science itself and in the social behavioral and communication sciences that help us to understand food systems, food environments, food information ecosystems, and how people actually respond to that guidance? So over to you, Alonzo, and great to see you.
Yeah, great to see you. That question could be a 14 lecture course, but I will stay to the time constraints. First a little bit. I don't assume people know the Robert Wood Johnson Foundation. We're the largest foundation in the United States focused solely on health. And we've been focused for a number of years, really on helping to support a broader evidence-based idea of health. And we phrased it in different ways over those years, developing a culture of health, developing a culture of health equity. We have supported some of the fundamental work, building the field of social determinants of health. So for us, a broader understanding of health relating to what you do every day, which relates to nutrition you eat, is much broader than a notion of health that's focused on just illness or when you are at a provider's office worrying about some particular malady. So our approach to health is around that broader sense of health. We do a lot of thinking about health and well-being, and particularly what gets in the way of good health is of great concern to us. What kind of social or political, economic conditions make it so that some people don't have the best health outcomes they could have and are constrained by that through whatever factors have created their inability to get to that care, poverty, other forms of marginalization. So that definition of health and trying to make that more broadly understood, health and healthcare is a right that people have is fundamental to what the Robert Wood Johnson Foundation is about. Also, I actually to bridge the bio a bit because I'll speak from both vantage points. Even though I've been at the foundation a long time, the longest time has been as a city and county health officer, working with definitions of health and population understanding and what to do to improve population health at a county and city level, Boston, Los Angeles, Seattle, King County, places like that. And making the evidence clearer for decision maker in the population. So evidence really important, and I'm sure we'll get into this a little later in the conversation. You know, we're working with some of the folks on the screen to make sure that we have strong evidence for the policies that we are pursuing in the states now. It's really important that evidence is broad. I call it kind of eclectic evidence. It includes the usual evidence, but it also includes evidence from people's experience and knowledge. Often in public health, we haven't spent enough time understanding emerging evidence from folks, regular folks. We haven't done a great job of communicating our evidence in the vernacular. So that's at the foundation and in my work over the years, I think both generating evidence that's meaningful and connected with people beyond our science community is critical, and then making sure that we use objective evidence to shape policy. I'm not going to get terribly political on this presentation, but I will say, and since I'm working with people on the screen about this, the current administration's reduction of the ability of us to get current evidence from websites that we had relied on as researchers, as policymakers, and I think the general population, not knowing, has relied on for things that support their own health. Very worried about the curtailment of objective scientific evidence about that we really need. And then I hope we can get to this. I think it's important. The nutrition issues are so important, and the current focus of some of the administration's activities around Make America Healthy Again are really important. But it's really important that we keep it factually based. Better eating is really good. Childhood obesity is still a problem, but 48% of children are not diabetic, only about a couple of percent. So we have to make sure that some of the statistics and evidence being used by MAHA is grounded in facts, so we can kind of deal with this in a factual way. So I'll close out my 4.5 minutes with that.
Thank you so much, Alonzo. I think this point on the collective evidence, fact-based, is really useful. And Emily, I'll bring it over to you.
Yeah, thanks. And thanks so much for this opportunity. It's really just a pleasure to be here and to kind of learn from others in the room and on the panel. So as Heather said, I'm Emily Copel. I'm the Director of Communications Policy and Advocacy for Food at the Rockefeller Foundation. And I was going to talk a little bit about kind of our current investments and strategy. And then I was actually going to kind of dive a little deeper onto Alonzo's point of like an example of evidence and kind of evidence generation that we found particularly compelling. But essentially, the foundation has committed about $220 million in a big bet on what we call good food for all. And that work is grounded in improving access to healthy and nourishing food, while working towards a more sustainable food system. So on the food team, we kind of approach this from the food angle. And when I say sustainable food system, I mean a food system that can withstand the effects of climate change and also reduce emissions. We have a separate health team that also focuses on kind of the health angle, but our food team focuses more on kind of food, how it's produced, and nutrition. And we do this kind of big bet has a few different elements to it. One is through a very robust research agenda that's geared towards more deeply understanding and standardizing how we understand what's in our food. That work is called the Periodic Table of Food Initiative. I recommend taking a look at it. And then we also work on a few initiatives that actually improve access. So for example, in the US, we support a portfolio of work called Food as Medicine, which is essentially providing healthy produce and nutrition support to people with diet-related and chronic disease. And then I also support on our kind of global portfolio, which is focused on sustainable school meal programs that are sourced locally, supporting local farmers with training and financing as they transition to more kind of regenerative and resilient climate practices. And in that school meals work, we're also very focused on ensuring those meals are nutritious and nourishing, and thinking about how you can develop those school meal menus to be that way and to also be sustainable. But I think, we have a few different mechanisms beyond grant making that we work through. So there's also kind of some of our influence work, which, for example, is through maybe communications or through convenings of bringing together different partners who are working together to advance certain goals. I think a lot of times people think of philanthropy as kind of just working in grant making, but we have some levers beyond grant making as well. And Heather, to your question about kind of evidence, I think that, we have this agenda that's helping us more deeply understand what's in our food and the micronutrient makeup of food. But I think some of the most important evidence that we've supported the generation of was actually some of our true cost analyses. For example, we did a true cost report of food in the US and found that the true cost of food is $3.2 trillion. That's about 3x what we actually spend on food. And reports like this have helped us kind of shed light on some of the hidden costs of food that are primarily driven by diet-related health issues, which account for over $1 trillion. and additional environmental costs like greenhouse gas emissions and biodiversity loss. And some of those types of evidence that we're able to generate can be very convincing when trying to illustrate like what we actually mean when we are talking about our larger food system and some of the larger costs that it incurs. And that's very helpful, I think, for policymakers and others who are trying to prioritize. So anyway, I'll pause there. I think there's a lot more that we could unpack. And like Alonzo said, you could do a whole lecture on just the first question, but yeah, hopefully that's helpful.
Yeah, at the end of this, you get offered a course to do for free. Just kidding, but I think the point is really well taken on evidence and also using evidence as a communication tool, that it's not just that you have facts, but you have facts that speak to what people care about, which in some cases sort of a climate or a pocketbook argument is going to be more than sort of the health argument per se. So with that, over to Megan M., our last screen participant.
Thanks, Heather. And hello, everyone. I'm so happy to be here with you all today. Like Emily and Alonzo said, we could dedicate a whole webinar series to these opening questions. So let's get after it. I guess to answer the first question, I'll start with my role at National Dairy Council. And for those of you who aren't familiar with, who we are, what we do, we are a nonprofit research and educational organization that's supported by U.S. dairy farmers as a part of USDA's checkoff program. So we're similar to other commodity boards like egg, soybean, avocado, and the National Peanut Board. My role at NDC ultimately supports science translation. So bridging the gap between nutrition science and research and practical communication and education, which we know has to be clear and relevant, as we just heard from those two speakers, to a variety of audiences, from healthcare professionals to consumers alike. And as a regulatory dietitian specifically, I also ensure our education is evidence-based and fully aligned with federal guidelines and regulations. Similarly, my role at your local epidemiologist also involves science translation, but more as it relates to timely events in public health nutrition, from research to policy changes, really things that can affect our day-to-day lives and what that means for most folks. I'll say both roles really boil down to helping our audiences feel informed with science-backed information or educational resources that can help them make healthy choices. To get to your second question on evidence, as a regulatory dietitian, the role of evidence means a lot to me. It's definitely my love language. A lot of what I do comes down to weighing evidence, particularly when reviewing messaging and education. In a lot of cases, we can feel pretty confident in a claim, especially when there's strong and consistent body of science, things that are supported by systematic reviews, meta-analyses, or consensus statements by authoritative health organizations. But where things get a little tricky and, critical thinking has to come into play is when the evidence is a little either limited, from a quantity perspective or, just lack of studies, or it's an emerging area or novel research question, or from a quality standpoint where maybe the evidence is mixed and still a little unclear. Either way, that's why there are methodical approaches to evaluating the certainty of evidence that researchers and reviews often use, things like the grade system. So we look at study design, risk of bias, relevance, and consistency. And from a communication standpoint, I think this last point is really important at this day and age. And I know we'll get more into this in a bit, but nearly all of us have access to scientific articles and, can throw out a PubMed ID number to cite things thanks to Google Scholar. But the public may not have the skill set that's necessary to fully evaluate the study and to interpret the results when considering the overall body of evidence. The Dunning-Kruger effect is real out there, I'll say. And I think sometimes that can get us into trouble because we might have a scientific citation to back up a claim, but it may not be indicative of the preponderance of evidence. And while open access is, amazing for so many things related to access to information, but most of us, if we wanted to, and if you're looking for much dated, or there's just not sufficient evidence to support it. So that's something I do a lot in my day-to-day role at National Dairy Council when it comes to claim substantiation and regulatory work. Now, the second part, as far as more research needs, I think we'll all agree there's always more room for nutrition research. It's a field that's considerably underfunded. But one area that was actually identified in the most recent scientific report by the dietary implementation and communication science. I think Alonzo spoke to this a bit. Eat, but science that supports how to shape or to nudge good healthy choices. Bringing in environmental factors, behavioral economics, policy change, access, culture. Because even if the dietary guidelines are perfect to a T, it does no good if necessarily aligned with the guidelines. So all of this to say, more implementation science to complement more nutrition science.
And then before we go on, I think all really important points. Global health, so maybe more familiar with DALYs. Can you just say very briefly what a qualia is and very briefly what the Dunning-Kruger effect is?
I'm sorry, what is, and can you say that again?
Qualies and Dunning-Kruger.
I heard Dunning-Kruger. What was the first thing you said? Sorry.
Qualies.
Quality?
Quality life years.
I'm sorry.
Didn't you reference? Oh, I thought you said something about qualities.
I may be missing that first term. Sorry, but I can speak to the Dunning-Kruger effect. Yes.
Great.
So, sorry if I missed that first part. So maybe I spoke about the quality of research, but
I thought you said qualities.
quality assured life. I know I spoke to the grade system, which, if you look it up, it's just a methodical approach to understanding the strength of evidence in the study. Now, the Dunning-Kruger effect is really interesting, and I think once you understand what it is, like you'll see day-to-day examples of it. Essentially, it's an X and Y axis where on the essentially with the less experience and knowledge we have, we tend to be a little bit more confident in what we know, and as you move along the X-axis and we get more experience and more knowledge and education, that confidence actually goes down because we really appreciate the complexity and the nuance of science. So it's interesting, with less experience and education, we're pretty confident. And then as we get more experience, our confidence goes down. And then over time, once you get really confident in yourself as a professional in whatever area you are in, it starts to go back up in the confidence again. But it's a really interesting phenomenon. And once you know about it, you do see it a lot online.
Awesome. Thank you. Over to that, someone just come back up the other side of that curve.
So as Heather said, I'm Megan Lott. I am a deputy director for the Health Eating Research Program, which is based here at the Duke Global Health Institute. Before I go into what we do at HER, I want to give you a little bit more context of my personal experience and how I approach nutrition and the work I do generally. So I grew up in Ohio in a very lower middle class family. My parents made just enough money. We did not qualify for programs like SNAP or WIC, but little enough money that every dollar counted. So every month I remember as a child going with my mom to the grocery store. Our goal was to shop for an entire month and only spend $100 on food. Now, this was in the 80s and 90s. So, I don't know what that would actually be today, but it's not a lot of money. And what that meant is we were buying a lot of prepackaged foods. And each week we would supplement by going to get, more milk if we needed it, more fruits and vegetables. But we were buying like bananas, apples. What are the cheapest, most, economically valuable pieces of food we could get? We ate a lot of Hamburger Helper. As an aside, I was reading an interesting article last week that said the sales of Hamburger Helper are a good indicator of economic status in this country. And right now, important to note that the sale of Hamburger Helper is on the rise. It's a convenience food people go to when they are struggling to make ends meet. So when I decided to go to school for nutrition and become a registered dietitian, I knew that I didn't really want to go down the path of one-on-one nutrition counseling and education in a hospital setting, because I had this personal experience of you can tell people what to eat till you're blue in the face, but if they can't actually afford the foods that you're telling them to eat, it's all for naught. So that really has impacted my entire career trajectory, from initially working in food banks across the country, running community nutrition programs, to then going to Washington, D.C., where I advocated for federal and state nutrition policy, like around national school meals, SNAP, farmers markets, other community food programs, to then here at Duke, where now I'm more on the research side of things. And so here today at Health Eating Research, this is also really connected because our mission is to support and disseminate research on policy systems and environmental factors or strategies that will promote healthy eating among children and families. So not just, what should they be eating, but how are we structuring food environments and how are we passing policies that actually support families' abilities to implement the dietary guidelines and actually eat in accordance with them. And so, another important point, health eating research has been funded by the Robert Wood Johnson Foundation for the past 20 years. So thank you, Alonzo, but also all of their work around a culture of health and equity has really impacted the work we're doing. And so we're also looking at how is the health of Americans improving overall, or does this policy, does the sugar sweetened beverage tax decrease sales of soda generally, but also how is it impacting those populations that are at greater risk of health disparities across the country? And so we have 3 main program goals, and evidence is embedded in everything we do. The first is really to build the body of evidence around what policy systems and environmental strategies actually work to make it easier for families to improve, their food security, their diet quality, live at a healthy weight. The second is to foster a really vibrant, inclusive, interdisciplinary field of researchers working on this space. And the third is to ensure that the findings from the research studies we're funding are then communicated to decision makers. Most members of Congress are not reading peer-reviewed journal articles. So we work really hard with our research teams to translate the findings from their studies into materials that are accessible to them, whether that's an infographic, a policy brief, talking points. Those are all really big pieces of the work we do. And we have a big focus on strategic science. So we are constantly talking to people on Capitol Hill, national advocacy groups, or other groups like those on the call to figure out what are the most time-sensitive policy relevant research needs. So right now you hear a lot about ultra-processed foods in the news. States are passing policies. We actually have an active expert panel right now where we've convened experts around the country on ultra-processed foods to figure out how do you create a new definition that works for regulatory purposes, that you can actually use in policies that are being passed, because a lot of states have passed policies that are really going to be challenging to implement as currently written. So, we have a lot of examples of how our research has been used to inform policy over the years, from school meals policy to dietary guidelines. But I think a big part of what we do is kind of working at that intersection of policy, research, and practice to identify what are the most policy relevant research needs, how do we fund those studies, and then how do we translate those findings to actually have maximal policy impact.
Awesome. Thank you so much. And we're going to pick up on that point of implementation too. Just a quick show of hands. Who knows what hamburger helper is? Okay, cool. Didn't know. Awesome. Okay, so for this next sort of roughly 8-minute block of questions, I'll start with Emily, and then we'll go Meg M, Megan L, and Alonzo. And poor panelists can jump in a little bit on each other. So thinking about policy formation, by whom, how, and for whom, I'd like each of you to shed some light on, how does policy, and from your different angles, so these different verbs may apply differently to each of you, but how does it get informed and shaped and made and implemented, which could include by a government at multiple levels, by philanthropy, or by another entity. And then in spite of these policies, people going about their daily lives, whether in the sort of their personal capacity, their professional capacity, some public capacity, or their political capacity, they might hear different things from different reports and clinicians and online sources. And so why does this happen, even if we have what might be clear policy on paper? And maybe we can talk just a team about how people can investigate and navigate recommendations from other sources. So Emily, feel free to pick up on whatever part of that you like for maybe about a minute and a half.
Yeah, thanks so much, Heather. And I will preface by saying that as a philanthropy and 501c3, we do not lobby or influence policy or legislation. So I'll And I'll talk a little bit more broadly about some trends I think that I've seen working in development over the last kind of 15 years. And this is with a little bit more of a kind of global hat on. And I think, you know, some of the other panelists in their opening remarks talked a little bit more in the weeds on kind of how the sausage gets made with like evidence generation to policy. So I'm going to speak from a little bit of like a more kind of global, broader perspective. I think some of the trends that I've seen is having a robust body of evidence, both on kind of the scientific side and also on the I think Megan, you mentioned this kind of the behavioral implementation side. Both I think are quite important. As you can imagine, you will have a policy, but then there's also the implementation piece. So how that implementation actually happens. If there's robust research that can inform that, I think that's extremely important. There's a lot of research that's been done around kind of having a trusted advisor to advise different government partners on kind of how to implement and how it fits into priorities and making sure that they have the research at the right time for policymaking agendas. But I've also seen that I think, you know, just more broadly in the global space, you know, global incentives or pressure or international frameworks, replenishment campaigns, these are also very kind of instructive, I think, in informing some national agendas. And that kind of links to development financing. So where there are opportunities for unlocking additional finance for a specific agenda, I think that will inform priorities pretty significantly. And you know, one of the things that we've seen with you know, school meals policy in particular, globally, oftentimes those policies are owned by a minister of education or a minister of agriculture, but not necessarily informed by a minister of finance. And so the incentives kind of need to align across ministries to inform kind of the prioritization within kind of the budgetary boundaries of kind of what a country can do with their domestic financing and where they need to unlock additional resources. And then I think technical support also plays a pretty instrumental role in actually informing that development, which some of the other panelists spoke about. So I'll pause there. I think there's a lot more to say, but hopefully that was a minute. I don't know. Over to you.
Over to you, Meg.
Thank you. Yeah, I'll focus on the second part of the question. Like Emily, National Dairy Council, nonprofit and under USDA's checkoff program, so we cannot influence policy either. But from a communication and trust perspective, I think the conflicting messages around health and nutrition is a really important issue we're facing right now. And you know, I like to talk about it as like if you've ever been in a relationship where you get mixed signals, it doesn't feel good, right? It kind of makes us feel a little confused and uncertain and maybe even a little wary, definitely not confident, safe, and secure. So as far as why this is happening, it's definitely complex and it stems from insights related to infodemiology, if you will. So we have this enormous amount of information available at our fingertips that can spread rapidly. And there's also the role of media and algorithms. So, you know, healthcare providers, scientists, and guidelines were once the trusted voices for health and nutrition advice, but that's just simply not the case anymore. So today, you know, we can do our own research, like I talked about before, and our information streams are filled with a variety of voices and health advice. So, you know, when folks hear conflicting guidance from online sources, you know, podcasts, influential voices, federal guidelines, MAHA, food policies, and then their own healthcare provider, you know, they might struggle to know who to believe, which can lead to frustration and mistrust, and in some cases, the rejection of credible recommendations. In fact, a recent IFIC report found less than 4 in 10 Americans strongly trust science about food and nutrition. So it begs the question, you know, at the end of the day, who will earn the public's trust? You know, is it someone with credentials or who references science, or someone who tells the best story with emotional appeal or scare tactics? Or is it someone who's simply, you know, relatable and accessible and comforting? And that question might really depend a lot on individual values and beliefs. But overall, the saturation of health advice and expertise it's making it harder to earn public trust and to advance public health. So I think, you know, the topic is definitely a call to action for us in this field to to keep these topics of communication and trust building and evidence and approachability top of mind, wherever and however our practice may be and how it may look.
Thank you so much. Over to you, Megan.
Yeah, I think those are a lot of really great points and really underlies the need for strong national dietary guidelines or federal, global dietary guidelines that are grounded in science, because those inform here in the US, for example, our national dietary guidelines inform nutrition standards that are embedded in programs like school meal standards or childcare standards. They inform a lot of practices that are happening when you go to your pediatrician and you're getting counseled on different behaviors. A lot of their clinical practice guidelines are based on that nutrition science when they're talking to you about nutrition science. And when you think about how policy gets made, whether by a government at the federal level or local level, often evidence is playing a role. And because it's either the policy is being built on that evidence or we're looking for more evidence on the implementation of that policy. Is it working or not? How is it impacting? What are unintended consequences? But I think the bigger issue at hand here is exactly what Megan just said about we have so much information coming that even with strong science, strong dietary guidelines, there's just a lack of public trust. And we see that trust continuing to decline, especially in government in this country currently. And so, the current dietary guidelines are a good example of this, where you have the Dietary Guidelines Scientific Advisory Committee put out a report in the end of 2024 based on really strong systematic reviews and a really strong scientific process. And now you have the current administration coming behind them saying, we're getting ready to release something that'll be totally different from that report. And we don't know what's going to be in it yet, but a lot of what we anticipate will be in it are guidelines that aren't really strongly backed in science. And so this adds another layer of confusion now about what should I be following, what should I be listening to, and it's something, what, who, and in this world, like it's something we're dealing with every day of how do we enhance this trust in the right information.
Really appreciate that. Over to you, Alonzo. Really looking forward to learning from your diverse experiences, including being.
I'm going to actually talk about this trust issue and put a little bit of the blame back on us as scientists. I'm an epidemiologist. I'll just speak about conversations with neighbors who say things like, well, you guys told us and made us feel good about red wine is healthy, and now you say red wine's not healthy. The history of epidemiologic nutritional science interface has been very hard for the general population to understand, because the relationship between food and health outcome is a complex science. And I think as we've been saying, there is a substantial evidence. There are great, very, very great reports. But as a science community, that body of evidence, I can say this even I'm a current academic as well. Who reads our journals really, except a few of our closest colleagues in our particular field, because we don't really have great transdisciplinary journals, right? So the issue when you have a transdisciplinary problem like food and health, and because we do not communicate in the popular vernacular sufficiently, we leave ourselves open to the Maha interpretation and whatever's going to come out, because they're going to combine a way of talking about it that we don't, and they're also going to reinforce some things that we have told people what weren't healthy, but they'd like to do. I'm going to go back to my public health practice career. I refuse to allow raw milk to be sold in many different venues around the country, because we knew it's the risk to immune compromised people. I mean, all of that. But that whole constituency, which kind of overlapped with the anti-vax constituency and the anti-fluoride constituency. That's a powerful constituency that doesn't trust our science communications because it goes counter to things that they believe fit their sort of their framework of evidence and science. So I don't think we deal with that very well, and I don't think we incorporate their knowledge very well or have a way of dialoguing with them. Somehow, I forget who talked about implementation science. But I wish our implementation science approaches included more community engagement to understand that this tension of different mindsets when our science information kind of hits the streets, something happens that's way outside the boundaries and discourse that often we as scientists believe we can kind of keep this bounded, which really opens it up for I think to my other colleagues' comments, what are we going to see in this new standard report that comes out, right? So I think it's something about our responsibilities to deal with that complexity in a different way. I'll stop there.
Thank you so much, Alonzo. And I want to pick up further on this trust point because, of course, this talk is called food for trust. So for the next little block, and I'll ask you guys to be barely brief because then we'll open it up for questions. But I'd like to focus even more on this sort of question of messaging and trust and communication for reasons that we've all talked about. So we are all consumers and maybe in some cases producers of food or supplements. And like many people, you may want to customize your approach to nutrition. Meanwhile, we're all also consumers and in some cases producers of evidence and policy. And finally, we're all potential communicators on these topics, rooted in the different roles that we play in our own physical and virtual communities around the globe. So starting with Meg M this time, it'll be great to hear you briefly discuss how you hope that trustworthy messengers from community, as Alonzo pointed out, to celebrity chefs, to decisions being made in capitals around the world, that, for the captive audience and budding communicators that we have here in this room, how might we talk about and work on nutrition topics given the current political moment, which includes MAHA here in the US, but aid cuts and other things around the world. So I will turn it over to you with your hopes for our budding communicators.
Sure. Yeah, so that gets to my first point. I do have some actionable thoughts to consider related to communication, like techniques and strategies, if you will. But I do want to start by just reinforcing what you just said. No matter what our specialty is, we are all communicators and should always be striving to improve our communication skills because, there's always more to learn, there's always more to question, and there's always more to be curious about and more voices to listen to, particularly the listening one, like Alonzo just shared with his neighbor. I'll just share that I was on a run group the other week and I heard a parent share their experience with nutrition advice and immunizations. And while I didn't necessarily agree with that from a perspective of science, I can tell you that their decisions came from a place of love and of protection for their child. And they thought what they were doing was the best thing for their child's health. And to me, it was just a good reminder that we're all humans first and mostly good people and mostly trying to do the right thing. And I know certain topics can feel really triggering and divisive, especially when we think there's potential for harm. So, of course, we want to speak out and call out and correct, but it can be helpful to take a step back and consider a few things. So I had 4 things I did want to share when thinking about effective communication strategies. That first one, with that running partner experience in mind, we should always try to lead with empathy and validation and not dismissal. Most people really feel like they need to be heard and understood. We all do, right? And I think I've read that perceived empathy is usually assessed by our audience within the first 30 seconds. So instead of immediately, correcting, start by validating the emotion behind the concerns. And studies show that this can help build trust. Next is listening to understand their unique needs. As I mentioned before, people's core values and beliefs vary widely. So it's important to listen for these things to tailor how we can best communicate. And that might require a little bit of initial research and preparation up front. But really just active listening can go a long way there so we don't make assumptions. The next one is pre-bunking. As we know, misinformation spreads really fast, and it usually wins when it comes to capturing attention. So an effective strategy can be to combat this with proactive engagement with an audience on potential falsehoods, even before they come up. when we give correct information alongside a clear explanation, it can give people a good, keen listening ear to spot red flags and even feel a little bit more confident in identifying reliable information and then dismissing false information. And then lastly, one that I'm trying to work on, especially on this panel, is balancing nuance with brevity and clarity. When it comes to science, we all love nuance, right? Things aren't always black and white. And a lot of times I'll answer a question with, well, it depends. And I'm sure a lot of people here can agree. And everyone hates that. I don't want to hear it depends. That can be okay. But a lot of times people just want your professional opinion. And this is where sound bites and bottom line up fronts can be really effective to get your message across. Because I've read that we have as little as 5 to 10 seconds to capture attention. And then, of course, we have to maintain it. So getting your point across up front and then following up with supporting information can be an effective strategy. And there's some really good resources out there that, Heather, maybe I can share with you if you want to share out. But the CDC has a good Clear Communication Index one. IFIC has a great resource for communication strategies in nutrition specifically. And then the Center for Food Integrity, Charlie Arnott, has a lot of good insights related to different audience profiles and then strategies you can use to connect and to build trust. So I'll pause there. Sorry. I love that topic.
I'll pass it to Emily, but I agree we can maybe collate some links afterwards and share
Sure.
it. So over to you, Emily.
Yeah, thanks. I'm like nodding along to everything you're saying, Megan, because I feel like it really resonates. I think broadly, just in communications generally, you want, and just kind of building on what Megan said, but going a little bit broader, you want to think about like, who's the audience that you're trying to reach? What do you want them to know? What channels can you use to reach them? And who do they trust? And I think that we're swimming against the current in so many ways in trying to correct misinformation. And my personal opinion is that there's only so much that we can all individually do without some larger system that's actually correcting the proliferation of misinformation. That said, I do think, especially when we're thinking about research and how do we translate research findings into things that are digestible to the general public, I am really in favor of doing more experimentation with trying to educate existing influencers who are sharing misinformation and correcting what they're sharing and helping them understand how they can use their platforms. Well, they already know, usually many influencers who are out there already know the power of their platforms, and some of them really take on that responsibility and use their platforms to amplify correct information. Others are kind of in a little bit of a gray area, and I'm personally kind of interested in finding more opportunities to educate those influencers to ensure that what they're sharing is grounded in good science. And then I think on the other side, as kind of academics and researchers, everything that Megan said is true. People have short attention spans, they're getting shorter, and there's probably more that the research community can be kind of trained on to start synthesizing those messages really distinctly. And there are actually some really interesting projects happening right now where that is exactly that is happening, to kind of train different academics and researchers on kind of how to make your research really pithy, which I know for anybody who understands like the depth of nuance, that's very difficult. But to Megan's point, we really just need to give the top line of, if you do one thing, this is the most important thing that you can do. And if it were my family, this is how I handle it. And that's, people increasingly trust the individual in the kind of space that we're in, and there's a lot of distrust of institutions. And so I think that we need to accept that and work within that evolving kind of frame, whether or not we agree with it. So yeah, back to you.
Alonzo?
Yeah, this is so important, and I really agree with a lot of what the two previous speakers said. Let me start with the researchers. One of the things we've done is required that the research that we fund, we're all in favor of articles in high impact journals, but our researchers have to also write something in the vernacular to the systems that these findings are relevant. And we augment that with training to our research grantees on communication. That a well-placed blog is really as good sometimes as as the article. Sometimes a super op-ed in a high-impact newspaper is a great way to get your information across. So, I think that's really important on the train on the getting researchers skilled up to do that. This trust issue is really based in my field, in public health, which where nutrition is a huge part of it. This trust issue comes out of a lack of a relationship problem. I mean, trust. I mean, that's how we know in our regular lives that trust is built through relationship. In public health, you relate to community maximally in an outbreak situation or in some crisis situation, but not in a continuing communicative context. Even in a local public health department, you don't do that. So there's something about building those trusted relationships through shared understanding of the generation of information, of developing a cohort of trusted community level communicators who can talk about the messaging. Right now, our field is struggling with, well, maybe we should be training public health directors to be better community communicators. That's true, but in their departments, they already have their nutritionists and public health nurses who are out there every day doing a really good job communicating with people at a community level because they do it all the time. So last time I was asked this in a conference by researchers um, um, about like how do you train yourself to do this? I said, well, if you think a little bit less about the way we were trained to talk in a conference and more like you talk around the Thanksgiving table, and use that skill set, that's about 90% of what you'll learn in a communication training. I think sometimes we uncouple from our authentic selves when we're communicating science information and kind of grip onto too much uh, of how they conditioned us in our advanced training. We need to be. It's called. We need the code switch. I think it's a good application of code switching. We really need to be able to do that much better than we do.
Alonzo, I really appreciate that. I'm sure everyone appreciates when you bring up nutrition guidance around the Thanksgiving table. Over to you, Megan, and then I think we'll have time for 2 questions, and I'll do quite a quick close.
Sure. I think there are 2 threads that have been brought up that I want to come back to. One is about consistency in messaging, and I think we can't underestimate the power of our partners and working together to really enhance the consistency of messaging. So one thing that we do with all of our releases of new studies, new information, new products is we have a broad partner dissemination strategy where we pull up here are the top 3 highlights and can you share this with your networks? If you want a newsletter blurb, here's something you can use. If you want social media posts, we've got them drafted for you. But I think you can't underestimate the value of that. Having a research study we produced showing here's recommendations on what your children from birth to age 18 should be drinking as part of a healthy diet or what they should be avoiding, and sharing that with groups like the American Academy of Pediatricians, the Academy of Nutrition and Dietetics, as well as other advocacy groups and research groups is so important because it's really enhancing that trust by just everyone is now giving more similar advice. The other piece is going back to your audience and the trusted messengers. And I loved what you're saying, Emily, about like experimenting with using influencers. That's something we've actually done quite a bit of with some of our releases. We've partnered with influencers who have a broad reach in diverse communities to say, like, here's what we want you to do. Can you do a post on this? They still write their own content, so it feels authentic to their brand and their channel, but they're now writing content and getting it out there that aligns with our messaging. And so we did this actually with our beverage guidelines. We did it with some picky eating guidelines and had really tremendous outreach and impact. And, unfortunately, they don't want to listen to me as a dietitian policy expert. They want to hear from the other influencers, the people they're already following. And we've had a lot of success with that.
It's awesome. Thank you so much. Can we open up for 1 question? Great. One burning question. Okay, we got one in the back.
Hi, I would first like to thank all of the speakers for giving such like inspiring talk. So I am a visiting PhD student here at DJHI, and with both my background actually in food science and global health. So it was very happy to hear we come together and bring this dialogue together. So my question is kind of specific, but actually to all panelists, is I heard Megan talk about the beverage drink policy, which is what I did for my master's as well. So even though I did in China, we found actually, so first, many stakeholders are involved. And second of all, for these kind of real world policies, which might take a long time and have a lot of factors involved in this, it's really hard to do a very perfect, like randomized controlled trial or anything. But this kind of evidence generated is very valuable as well. So I would like to sort of given this and talk about how can we maybe better translate this kind of imperfect but still valuable evidence into actually actionable or credible policy actions that can actually benefit more people. Thank you.
Awesome. So I'll give each panelist, I'll start with you.
Sure.
30 seconds and you can bundle this into your answer plus takeaway.
Yeah, I think we have to reframe in nutrition science, the gold standard can't be a randomized control trial. You can't put a bunch of kids in a room and say, let's only give you high caffeinated energy drinks and see what happens. It's just unethical. There are so many problems that are going to stem from this. And so we have to really think about shifting what is that gold standard of evidence. I think very infrequently in this kind of nutrition guidelines is it ever going to be a randomized control trial. It's just not, you can't put people in a locked up room and control everything in their environment. And so how do we use the best available evidence we have to make policy progress and then start to evaluate what are those impacts at a population level that we see these policies happening? I think is really how we need to reframe some of this. That's a lot of what our program has been working on. So that's a really short answer. I'm happy to talk more about beverage specific things later, but
I really appreciate that. And I think, yeah, understanding what is actually the gold science for different types of questions, because there's different ones, and relating to this eclectic mix that we've talked about, implementation science, strategic science, behavioral science, that it all plays a role. I'll go to Emily, Meg, and let Alonzo close, and then I have a few things that I have to say in the last minute.
Yeah, and Heather, can you just like reframe the beginning of the question? I just want to make sure I got it.
I think in general, this can be a moment for you to give your takeaway, but in particular, it was around sort of how do we influence policy with facts when we can't always do RCTs? I think is a partial summary.
Oh yeah. Okay. Yeah. I mean, I think you kind of touched on a lot of the different approaches, and I think there are a lot of different entities out there that are doing kind of right fit evidence to ensure that decision makers have the information that they need when they need it. Shout out to ID Insight, where Heather and I previously worked, and they do that globally. But I think my general takeaways are, I think, like I said before, we're kind of swimming against the current here, but there are a lot of really meaningful things happening to improve both like public education of nutrition and also inform policymakers around kind of with robust evidence in the US and also globally. And I think there are a lot of mechanisms in place to do that, but they, obviously need fuel to kind of keep going. And I think my kind of larger hope is that we can find some of the things that are really, really working to swim against the current. And from a foundation perspective, keep investing in them, keep piloting them, and seeing what's working.
Excellent. Meg?
I don't want to take up too much time because I just agree with what they just shared. I think just leaning on authoritative health guidance from consensus statements and organizations like AAP, AND, healthy eating research is just a good way to show there is strong evidence because other people have already done the analysis and the evaluation for you. So I'll just share that.
Excellent. Appreciate that. Alonzo?
Yeah, I think my colleagues on the panel have really said it all, that basing on the evidence. some just caution that gold standard evidence has now become a political construct. And those of us in the research field, as you said initially, have known that RCTs are not the gold standard for all kind of inquiry for all the reasons that you mentioned, right? And sometimes even in those areas of biomedical science where RCTs have been considered the gold standard, they miss so many things, right, in terms of the limitations of how those studies are conducted, that sometimes the information is not what you need it to be. All to why I wish we could explain science better to folks, maybe from K-12 on, because one of the big mistrust things that happened, catalyzed by COVID, that we had not communicated what happens when you're in the early stage of something you really don't know anything about, like a novel virus. The key word was novel. And so people saw iterative science in action and got kind of concerned, upset about it. Because, so I think we could do a better job of the iterative nature of knowledge building in science, so that and open to that, make that transparent, which I think would kind of help with the trust process and get out of dichotomous conversations about gold standards.
Yeah, I think that kind of learning out loud can be something that we do to signal our trustworthiness. And so just to very quickly close, to say we've learned, I think, a lot about nutrition and nutrition policy, but just overall trust is not automatic. It requires investment in being trustworthy. We need to earn it. Humility, skill, transparency. I think we got some really amazing tips here on how to do that. So I just really want to thank our panelists from joining close by and from afar. And for everyone's participation here in the room and online. As a reminder, you can watch this video, slow motion, double speed, whatever you want, from the event page online. And we will go ahead and try to collate some of the links and points that got looped, and we can circulate those somehow. And so I just really want to thank